Hi, I'm Himashi Hapangama and I'm from Sri Lanka. I'm a geneticist and an embryologist, and I'm working as an IVF scientist at the Lanka Hospitals. That's one of the biggest hospitals in Sri Lanka. So I'm here today as a part of Merck Embryology Training program. And I'm really happy to be one of the first Asian students to be chosen for this program. And so if I just talk about fertility scenario in my country, Sri Lanka is a conservative country. So we think a woman's ability to conceive a child is given utmost importance from our society. So this conservative framework of society tends to point the finger at the woman, although sometimes the woman is not at fault for this fertility condition. So actually it's a stigma in our country. And if you see culturally, a woman is not accepted in an auspicious event because of not having a child. So this program helps me because I can address these problems in my country to make sure that it is a joint effect, not just the woman is at fault. And then of course another key challenge in my country is the fact that there's lack of knowledge in male infertility and treatment options. A lot of clinicians, they don't know how to diagnose properly, and they don't know what treatment they should opt for depending on the diagnosis. So it is important to know what treatment you should apply for it. So we have a lot of patients who have undergone years of treatment, spend a lot of money, but actually the proper treatment was not applied for them. And another problem we face is the lack of properly trained and qualified embryologists in our country. There's only 6 embryologists, including me. So I'm very happy that Merck Foundation give me this opportunity to enhance my skills, my knowledge, because having a very strong theoretical background and very good practical skills in embryology is very important. It's not just important for me, but for my patients, because the better I am, the better the results will be for the patient. And of course, as I said, the number of embryologists are less in our country. So if you have good trained personnel helping these people, it will benefit the whole country. And again, to address the cultural stigma we are having, the social stigma the women are facing because of this fertility problems, to make aware that both are the same panel, it's 50-50%, not just one person at fault for not having a child. And then if I talk about the course of this IIRRH center gave us, actually when I came here, my expectations were to perform ICSI, IVF, vitrification, that is freezing of embryos and oocytes independently. And I'm happy to say I'm now quite confident to perform ICSI, and I can do vitrification. So it will be very good for me when I go back to practice all these skills. And not only practical, as I said, IIRRH Center in Bangalore gives you great theoretical background. So you know what you're handling. You're not just a machine doing ICSI, but you know, okay, this patient has this problem. So you have a good theoretical background to support the treatment options you are going for the patient. So, and of course, this covers the syllabus of American Reproductive Society. So it's not like you're just focusing in Asia, but your knowledge comes up to that level where you go up to American standards. I'm delighted to say that we were able to do the American Society of Reproductive Medicine certificate course along with the certificate course they offer at the center in Bangalore. So doing the ASRM certificate course gave me in-depth knowledge to American standards as well. It was so good for us Asians to be in par with the Americans as well. To know, when you look at it, it talks about not just embryology, it talks about genetic aspects of fertility, of embryo biopsy, which are new techniques, and especially Asian countries, I should say, we don't focus that much on genetics. We don't look at it that much. We don't give it much impact. Whereas when you study, you see that the world is looking into it right now. Just to talk about the ASRM certificate course, It covers a wide range of topics, like starting from the basics of physiology of the anatomy. It goes up to advanced topics such as in vitro maturation of oocytes, then time-lapse imaging, embryo hatching. And as a geneticist, I was enthralled to find that it has an in-depth coverage of genetic aspects of fertility treatment. And then another interesting factor about this course is that one whole chapter covers the issues of the legal and the ethical issues of fertility treatment. So it's a very in-depth theoretical course. So it's a perfect blend. It's a nice blend to do a lot of practical work in this IIRRH certificate course and then to cover so much of theory. And of course, Merck gave us a phenomenal chance for us to be in par with American standards and not just to be limited to Asian standards. Actually, this course exceeded my expectations because now I'm not scared of IVF, I'm not scared of ICSI anymore or embryology. It's actually very good for me. I got exposure in how to use poloscope, PGD, that is pre-implantation genetic diagnosis, quite a new technique which is for Asian countries. It's a new technique. And I'm happy to say that when I go back home in December, we will be implementing PGD at our hospital for the first time in Sri Lanka. And then when you talk about embryo freezing, I got experience in embryo freezing, oocyte freezing, and of course all sperm preparations. Apart from that, we got a nice theoretical knowledge on stimulation protocols and of course how to maintain an IVF lab. When I think of new future students who wants to join this course, I would advise you should read a lot. This time of 3 months, you're spending over here, read as much as you want. And the coordinators, the lecturers over here are so friendly that you can go and ask them anything and they are so ready to help you and answer your problems. I would like to thank Merck Foundation for choosing me as a candidate for this course, for this embryology course. And I should especially mention that it is only Merck in Sri Lanka that's offering to train embryologists and fertility specialists in Sri Lanka. And of course, Merck gave me a stepping stone to be a better embryologist, to be a better scientist, so that I would be helping the patients in Sri Lanka. I'll be enhancing fertility treatment in Sri Lanka. So thank you so much, Merck Foundation. And thank you, IIRRH Bangalore, for this opportunity. I greatly appreciate it. I greatly value it. Thank you.